everyone. Welcome back to the Bulletproof Hygiene podcast. It's Brittany, and this week I'm going to be talking about what's trending exactly in dentistry and dental hygiene. As we know, healthcare inevitably continues evolving faster than we can keep up. It seems fitting at the end of the year to touch on and look back at what's trending in dentistry and dental hygiene. The purpose of this pod is to provide a small amount of information about many changing aspects of dentistry and dental hygiene. If you hear something that you'd like to know more about, please be sure to drop a comment on our Mighty Network by downloading the Mighty Networks app and searching Bulletproof Hygiene. Leave us a request for a pod topic, and we will be happy to accommodate. We love suggestions for new podcasts. So the first thing is not very striking, but something that's still kind of trending and becoming more consumer-oriented, and that is convenience. So although not a breakthrough in technology, the rising value of convenience needs to be taken note of. There's been a significant focus on the comfort and convenience of patients in healthcare recently, and dentistry is no exception. Patients nowadays have several options when choosing healthcare providers, so it stands to reason that they will pick the easiest and most comfortable option. For example, online portals to book appointments and fill out forms, expand office hours, online payments, and additional services are always to improve the experience for patients. The second thing is emotional dentistry. On a similar note to convenience is emotional dentistry. So one of the more interesting trends to come up as of late. As the term suggests, emotional dentistry focuses on the emotional and mental aspects of dentistry, not just the physical parts. Emotional dentistry uses new techniques and technology to create virtual images of the patient's appearance once the procedure is over, before the procedure has actually begun. This can also help patients decide which procedure will be best for them. Emotional dentistry has shown remarkable effects in improving the patient experience, especially in cosmetic dentistry, emergency dentistry, and orthodontics. When used properly, it can help calm their nerves and give them the confidence that they are making the right choice. The next thing is Tele-Dentistry. Telehealth is one of the bigger trends to come out of the pandemic, and it looks like it's here to stay. While there might be some limitations with teledentistry, the lack of direct care, for example, it also provides several benefits. Tele-dentistry allows ease of access for the 20% of Americans who live in rural areas and can't easily obtain care. Tele-dentistry has also been found to be as effective as in-person consultations when it comes to diagnosing cavities and providing treatment plans. The next thing is 3D printing. The global 3D market is expected to expand by 21% from 2021 to 2028. 3D printing is on its way to becoming more mainstream, which will allow it to play a much bigger role in dental practices due to accessibility and lower costs. 3D printing uses materials like resins and greatly speeds up the processes of creating custom dentures, crowns, clear aligners, and more. More possible applications are even coming to light as 3D technology advances, with general dentistry, implantology, and prosthetics all standing to benefit. Laser dentistry. Like 3D printing, laser dentistry is also one of the biggest trends in dentistry. Before laser dentistry, procedures like filling cavities and repairing damaged gums required invasive and often painful treatments, as we know. In some cases, laser technology can even replace dental drills to remove or reshape tissue, remove decay, repair fillings, and more. Laser dentistry allows for minimally invasive oral surgery, reducing the need for sutures. It also allows for less bleeding, little to no pain, faster healing, and a reduced risk of infection. The next thing is subscription-based coverage. So the dental industry has a high level of financial barriers, causing many people to avoid seeking care. In fact, about 69% of people who don't receive dental care do that because they can't afford it. Even for those with dental insurance, it can be difficult to find a practice covered by their insurance plan. That's where subscription dental plans come in. Subscription services offer an annual or monthly rate that can cover cleanings, x-rays, and even fillings and surgery. Studies show that 83% of consumers prefer practices with a membership plan, making it beneficial to both patients and dental clinics. Next is Consolidated Practices. So fewer and fewer dentists are working as solo practitioners, with only about 50% currently being solo practices. One reason for this could be the amount of student loan debt carried by the average dental school graduate, which is roughly $300,000. Additionally, the cost of opening and managing a dental practice can be difficult for individual dentists to afford. Group dentistry can help solve these problems while ensuring a well-equipped dental practice. So the overview of this kind of dental-based segment is that the majority of these trends focus on improving patient care and the overall patient experience, including comfort, accessibility, affordability, and advanced treatments. In addition, there are a lot of technological developments making their way into the dental field. And although dentistry it most definitely isn't the first field to adopt new technologies, it's gearing up to be even more cutting edge coming soon, and that is a constant. So the next kind of section here is more dental hygiene specific. So these are the 15 trends impacting dental hygiene practice and our profession. So the fast pace of innovation, technology, and research impacts the profession of dental hygiene more today than ever. And as such, it's critical for the progressive clinician to be up to date on these changes. An understanding of trends impacting daily care strategies, clinical practice, and professional development will arm clinicians with the resources to maximize patient care and professional growth. So first little segment here is, how do you clean in between? So when the Associated Press broke the news that daily flossing may not be necessary or an evidence-based practice, you could hear the collective gasp from the dental community. The American Dental Association and the American Academy of Periodontology were swift to respond. And as a result, there has been a shift away from floss exclusive recommendations to ones that are inclusive of a plethora of interdental cleaning aids available. Instead of focusing on the daily use of floss, clinicians may instead ask patients how they clean between their teeth, taking away the floss guilt. The ADA's consumer site, Mouth Healthy, now recommends the following: brush your teeth twice a day, clean between your teeth daily, eat a balanced diet, and schedule regular dental visits for a lifetime of healthy smiles. The timeless adage, brush and floss, is now being replaced by brush and clean between. The next thing is do-it-yourself dentistry. A recent search on YouTube for do-it-yourself dentistry resulted in over 2.5 million results. Everything from tooth extraction to filling cavities to do-it-yourself orthodontics is shown in graphic detail. These posts have alarmed oral healthcare professionals who have seen the results. While many of these activities do not cause irreversible damage, they do cause confusion, and obviously many of them do cause irreversible damage, especially in preventing or curing decay and gum disease. So, for example, breaking open activated charcoal capsules onto a toothbrush has not been shown to provide any benefit and may actually cause enamel abrasion. Savvy clinicians are encouraged to monitor trends and be prepared to provide patients with evidence-based education about these things. There's an app for that. An estimated 165,000 apps are specifically aimed at health and wellness, with 70% designed for the general population, offering tools to reach and maintain wellness and to improve physical activity. The remaining 30% are for healthcare professionals or those with specific diseases. Dental-related apps specific for tobacco cessation, oral health tips, tracking oral health habits, and dental health education are also in this number. So connected app technologies such as power toothbrushes provide patients with real-time feedback and tracking of oral health routines, including goal setting and incorporating clinician recommendations. Clinicians should become familiar with app technologies relating to daily healthcare and well-being to make appropriate recommendations. Future research will include evaluation of these technologies and their impact on oral health. Smell good, look good. Patients continue to be interested in fresh breath and whiter teeth. The significance of societal aspects has been acknowledged in definitions of oral health from the American Dental Hygienists Association in 1999 and the FDI World Dental Federation in 2016. The ADHA defines optimal oral health as a standard of health of the oral and related tissues and enables an individual to eat, speak, and socialize without active disease, discomfort, or embarrassment, and that contributes to general well-being and overall health. Clinicians understanding this social connection can leverage treatment and daily care recommendations with fresh breath and stain-free teeth in mind. Recently launched innovations include a sonic irrigating power toothbrush, a whitening irrigating system, and app-connected power technologies with whitening or fresh breath modes that will change daily care recommendations. Moving from manual toothbrushes to plaque-busting, breath-freshening, tooth whitening powered technologies not only provides patients with what they want, but also improves their oral health. Defining standard of care. In 1985, the ADHA developed the Standards for Clinical Dental Hygiene Practice, now in its third revision as a guide for the individual dental hygienist practice. Revised in 2016, this document A must for every dental hygiene clinician and employer, provides the foundation for the standard of dental hygiene care, which includes assessment, dental hygiene diagnosis, planning, implementation, evaluation, and documentation standards. As standard of care continues to be refined, this is an invaluable resource. So the potential end of drill and fill. In April 2018, the ADA put out a call for comment on its proposed clinical practice guidelines on the use of non-surgical or non-restorative treatments for caries management. The proposed guidelines include the utilization of silver diamide fluoride to arrest carious lesions, along with sealants, fluoride varnish, and resin infiltration, and focus on arresting or reversing caries infections versus drill and fill. Oral systemic connection. Consumer awareness of the oral systemic connection has increased exponentially through social media and advertising. For example, a recent television commercial for dental implants features a patient explaining how his cardiologist insisted that he take care of his oral health for the sake of his heart health. This messaging is repeated throughout many platforms, educating consumers about the importance of optimal oral health. Interestingly, one of the most impactful YouTube videos trending on this topic is not produced by the profession, but by Business Insider's video channel Tech Insider, and it's called What Happens If You Don't Floss. Infographics have also been beneficial in educating consumers. A recent search using the terms oral health infographics yielded countless educational materials on dental-related topics. Progressive practices would be well served to utilize these resources in maximizing patient education. Biofilm busting technologies. Deplaquing has become an integral part of clinical intervention, as it's not enough to remove obvious calculus and stain, but the microbiome must be disrupted as well. Powered scalers with thinner tips have played a major role in clinical deplaquing, along with the more recent use of air polishers subgingivally. Therapeutic benefits of subgingival air polishing using glycine and newly launched erythritol powders include removal of biofilm and reduction of pathogens in periodontal pockets. Erythritol powder is indicated for light to moderate stain removal, supra and subgingivally, and is safe to use on all surfaces, including soft and hard tissues, restorative materials, orthodontic appliances, and implants. At a minimum, every patient should be deplaqued with power scaling and thin inserts or via subgingival air polishing. Rethinking the use of technologies that impact biofilm is an important part of overall care, patient comfort, and efficacy. High times. With more states legalizing recreational and medicinal use of cannabis, it will be critical for dental hygienists to gain knowledge and understanding of the use and types of this drug and its impact on oral health. The ADA has an excellent overview on its website in the Member Center that includes an introduction, oral effects of cannabis use, dental care implications, references, and resources. Virtual continuing education. Virtual platforms for education have become popular as the technology has improved. From entry-level programs to continuing education, these platforms provide convenience for learners. There are many sources providing exceptional continuing education, from associations to dental publishers to oral health companies. Clinicians should check state statutes to confirm what types of virtual education platforms count toward required continuing education credits for renewal. For some, the best option is a live webinar that offers an interactive component. Convenience aside, it's difficult to match the energy and interactive opportunities of live continuing education. However, without the opportunity, virtual is the next best thing. Opportunities beyond the chair. As private practice settings decline in favor of dental service organizations, even the clinical practice of dental hygiene is providing opportunities beyond the chair. DSOs offer dental professionals a way to focus on patient care versus the business and administration of the practices. Dental hygienists are being sought for their expertise in a variety of areas, including oversight of the DSO's dental hygiene program, administration, infection control, and continuing education, to name a few. Moreover, there are expanding opportunities within the oral healthcare industry, such as consulting, administration, sales, professional educating, research, training, and marketing, in academic educational aspects, in public health, and research organizations, or as a business owner even, and even within some medical facilities. With expanding roles and the establishment of mid-level providers throughout the country, dental hygiene's future is solid. Professional coaching. With the expanding roles of dental hygiene, more of the profession is heading back to school with a good reason. At a minimum, a Bachelor of Science degree, ideally an MS, will be required in settings beyond the traditional clinical operatory. Those interested in expanding their professional opportunities can look to virtual or online programs, as well as on-campus accelerated programs. So, for example, a one-year Master of Science in Dental Hygiene at the University of California, San Francisco School of Dentistry, to complete their degrees. Additionally, a number of entities run by dental hygienists for dental hygienists have recently emerged that specifically address career coaching. Postural health. The ability to maintain postural health throughout one's clinical career has greatly improved with the availability of technologies that address ergonomic issues. From lighted loops to saddle-style operated stools to powered instrumentation with illuminated tips, there are a myriad of options to enhance ergonomics. Furthermore, the profession has begun to embrace wellness strategies such as yoga to alleviate carpal tunnel syndromes, along with neck and lower back issues. A greater understanding of clinician and patient positioning combined with technology offers proven methods to extend pain-free clinical practice. Collegial Collaboration. The only formal organization that brings dental hygiene professionals together through membership is the ADHA. In its 2017 to 2018 annual report, the organization reviews the numerous accomplishments and challenges facing the association and the profession. For example, in the revised 2018 Standard Occupational Classification from the United States Office of Management and Budget, dental hygienists are now classified as healthcare diagnosing or treating practitioners, which is the same grouping as dentists. This is a change from 2010. This is an important classification as the role of dental hygiene continues to expand, addressing access to care issues. These are some of the hottest topics in dental hygiene and dentistry at this moment. If you would like some elaboration on any of the topics, I would love to. I think it's really cool to hear what has been happening the last few years, especially post-pandemic, regarding our profession. And I'm very interested to see kind of what continues to evolve and how this continues to expand, which, as we know, is the promise of any science-based healthcare field. So thank you all for listening. Don't forget to join us on our Mighty Network by searching Mighty Network app and downloading the Mighty Network app and searching Bulletproof Hygiene. We will see you next week.